A lot of the patients that I see in my clinic have been dealing with pain for years. A lot of times you can see it in their eyes. You can just see it in the way that they talk to people. They feel as if there's no hope and that there's absolutely nothing that can be done to provide that quality of life. But this is an extremely exciting time to be a neurosurgeon because the technology that's out there, it's almost mind-blowing how quickly things have evolved. Just the whole introduction of minimally invasive spine completely revolutionized the way that spine surgery is done. I got to train with some of the people who pioneered these original techniques. And I was lucky enough to be one of the first people in Texas to learn how to do robotic spine surgery. So I also trained with a lot of people that were up to date on the latest and greatest technology. And I've learned the entire gamut of open, traditional neurosurgery, all the way through the ultra minimally invasive surgery. And that is truly one of my passions, is looking at a problem that a patient has and just assessing, how can I actually make this better? How can I do this differently? I don't want my patients to be in the hospital for 3 to 4 nights. Nobody wants to be in the hospital for 3 to 4 nights. I can look at your problem. I can think about the technology. I can think about what I can bring to the table to do this in a better manner. Get you back on your feet, get you feeling better, get you back to your life just as quick as possible.